Tantrums.
Yeah, so tantrums really can start at any age, right?
Yeah.
So it's
And drive a parent crazy.
And drive a parent crazy. So right in the middle of shopping, you go ahead and the kid starts to cry, and you don't know what to do. The kid wants a toy, and the kid wants a toy now. So that becomes an issue for the parent, and they don't know how to react to it. And they just want to quiet the kid down, and they go ahead and take that kid and give them the toy, and that's it. Or if at home the kid starts to cry for something, the parent just goes ahead and gives that. But really, as a parent, you need to understand is you have to set the limits for the child. So,
have you ever been on a conference call and had a kid? I'm telling you, if a kid asks for $1 million while the parents are on a conference call, they will probably get it. The kids haven't cracked it yet.
But the kids know that. The kids know that because
you think so?
Yes, of course they know that. That when mom is on the phone, that is the best time to ask for something. Okay, so that is what it is. But
mom is constantly on the phone.
And then, this could be just a behavior management issue, so the parents need to know how to deal with that. And really, I think not giving in and setting those limits is what is most important as a parent to understand.
Yeah.
But as the kid grows and you start to see these signs of the kid acting out, that could really be a manifestation of something else. Okay, which is where we're going to be leading into the topic of ADHD
Tantrums
and all
ADHD,
that.
yeah.
Okay, and then that can I think we do have a caller, so let's just go ahead and take that.
No, you press the button this time.
Oh.
Did you just cancel on this?
Sorry, I just I'm still learning the technology.
Raji has to give us a book on how to make this work.
So the kids can be fidgety, the kid can be running around, fighting, doing other things, and talking back, and the parent doesn't know what is this behavior that the child is showing them.
So a couple of things, right? So as a parent, when you see a child acting out at a party, it's the first. So many a times a parent themselves might not know that there's more to a child than a problem, right? And I know we have a caller calling in.
So yeah, I think thanks, Kulji, because I was not. I didn't disconnect you now.
Hello, you're on the air.
Hi.
Hi. This is...
Can you introduce yourself and what's your question, please? Hello?
Hello, yes. So, I would like to, know how do teachers at some point identify that it's ADHD, and I am a yoga, I do yoga and I do that for you. And I feel that a lot of these things can actually children can actually benefit from yoga and the right food and diet. But I'm wondering how much in the mainstream does that come through?
I'm sorry, how much in the mainstream what?
Sorry, my name again is Priya. Priya Vishwanathan. I'm calling from Robbinsville. So my question is, I think in my experience, yoga, for little kids, and also, giving them the right diet,
right,
which is, not loaded with potatoes and a lot of these things that, the sugar high foods that cause us to be very extra active and
right.
How much of that is, you think can be incorporated and brought to light in the mainstream?
Okay, sure. And I think, thank you very much for this question, because I think that really brings to the soul of the show of integrative pediatrics, where yes, you can have, behavioral therapy, you can have medications that can calm a kid down for ADHD or oppositional defiant disorder, but really the adjunct of all of these things, like diet modification, like yoga, like meditation, can really help the child and hopefully decrease the need for medication. So knowing how to use them and finding a physician who can help you guide that, I think is really important.
So Priya, in case you didn't know, that was Dr. Naveen Mehrotra and I'm Anika. Thank you so much for your question. And I think Dr. Mehrotra, to your point, how many pediatricians actually discuss diet? And how many would say that, I want to understand what you are. I want to understand what you are giving them to eat.
Right.
So that how many really believe that food actually influences the way they are behaving?
Well, a lot of them may not, but it is so timely. Actually, this morning when I turned on ABC News, the medical topic for the morning was about how food coloring can actually make behaviors worse or can make some of these
And
ADHD
food coloring
control.
is in everything. Because
Right.
everything has to look pinker and greener and bluer and
So now there's
rarer.
a lot more scientific
Yes.
research behind it and a
Yes.
lot more literature that's there. But there is
Yes.
a lot to be said about food coloring,
Yeah.
about the diet that the child is taking
Yeah,
to help them with the management of those symptoms.
yeah.
So, trying to avoid food colors, food dyes to the extent that you possibly can, because every single food has some sort of dye in it.
Yeah, yeah.
So, trying to make that conscious
Every
effort.
single non-real food.
Sure. But
Yeah.
you'll be surprised.
What do you mean?
Even, okay, so even if you go to, let's say, a lot
Buy
of
an
us are-
orange or a tomato.
Right, but if you, let's say, take carrot juice from Costco, right?
Yeah, well,
Everybody-
yeah,
yes, right?
absolutely.
So it
Yeah.
is. So
Yeah.
you think it says 100%
Absolutely.
juice,
No, it's,
but
yeah.
it is so
It's
well
not
colored.
Concentrate. No, you're absolutely right. I mean, carrots from my garden don't look that orange, so you're absolutely right on that. But coming back to the topic of ADHD and kids, and this is, I put myself at fault for this as well, as that as an Indian parent, I might go to a party and there might be a child who's acting out, and I might say, oh my God, it's such a ill-behaved child. देखो मतलब उसको control ही नहीं कर सकते, right?
Right.
But the point is that many a times a parent themselves might think that it's just, that the behavior is very, that it's very,
It's
that he's
normal.
just, that's
Right.
normal, or
Okay.
that he's just being temperamental. So as a parent, I mean, the last thing I want to hear is that my child has, there was a time I remember when ADHD was a bad word, so to speak, and now people are saying that people are over diagnosing it.
Right. So I'll tell you a story from yesterday. Yesterday I went for my haircut.
Yeah.
Okay, I was sitting at the
There's an
haircut.
ADHD story at the haircut place.
So
All right,
right
you're
next to
truly
me,
embracing my whole child.
Right next to me was a kid who was getting a haircut, and after the haircut, the kid was bouncing around from place to place in the whole
That
salon.
sounds like my kid.
Right. So the beautician
And the
or this is
pediatrician in you.
the hairstylist goes, oh, this is normal Indian kid behavior.
Oh,
Okay,
it's
so
a kid,
that
Indian
and
kid.
right, an Indian kid and an Indian salon. So I went there and I'm listening to this, and obviously I don't tell anybody that I'm a pediatrician outside. So I didn't. I was just
Nor do you tell
observing.
anyone that you're Indian, obviously.
So I was listening to this and I was looking at this, and this is sort of what our community understands,
yeah.
right?
And
so they
is-
don't know where
yeah.
they should really discipline
Yeah,
their kids and where
yeah.
they shouldn't,
And they're
Or-
excusing it.
and they're excusing it.
Yeah,
So,
yeah,
so first of
absolutely.
all,
Right.
trying to make sure that you learn the proper discipline skills
Right.
and
Right.
teaching the kid what is right behavior and what is not.
Was she right in her analysis?
She was right in what she said,
Yeah.
but I don't think that is what would conform to normal behavior here.
No.
Right.
Exactly. So,
So-
she disqualified it by saying it's Indian.
Right,
So,
right. But now, what Priya brought up,
Yeah. Yeah.
thanks Priya for doing that,
Yeah.
is that as part of that behavior management, that parent may need to introduce yoga or
Yeah.
may need to introduce meditation to this child to
Correct.
teach them the skills how to behave better
Correct.
if it's required.
Correct.
And at the same time, make a conscientious effort on the diet.
Correct.
So trying to cut down on the sugars, trying to cut down on the processed foods, trying to cut down on the saturated fats, because those are the things that have been associated
Good.
with
Yeah.
bad behavior
Yeah.
in kids.
Yeah.
So once again, making those efforts,
Yeah.
and then really getting to the medical aspect and
Yeah.
saying, is this a medical illness like
Yeah.
ADHD,
Yeah.
which needs treatment? So at that
So
point,
when do you know that?
and that is where I think you need to work with your physician
Right.
and make sure that.
So will my pediatrician take me seriously if I call up and say, my kid is acting up? What do I do?
That should be one of the most common things that we deal with.
Oh,
as a
really?
pediatrician,
So what do
yes.
you do when someone comes and says
So
that?
it once again depends on what the issue is.
Okay.
So what the age of the child is.
Okay.
So the first thing is important is to get a full history
Okay.
and to make sure that you do a full medical exam on the child.
Okay, which will entail, I don't know, blood
You know,
test to check whatever.
Whatever,
like,
if there is a blood test
physically.
that's required, that may
Okay.
be done as well.
Okay.
And at that point, if it is just a straightforward behavior issue, we may be able to counsel the parents and teach them the skills on what needs to get done
Okay.
so that the child and the parents can have a nice happy medium at home.
Has ADHD gone up, or the cases, number of cases of ADD, ADHD, and I'm assuming the two are different,
Right. So ADHD is a common term that we've seen now, and I
which
think
stands
it's
for,
attention deficit hyperactivity disorder.
that sounds like me.
So that can be, and if you take ADD, which is take an attention deficit disorder, you take the hyperactivity part out.
Okay.
So those are interrelated. And then along with that, you have a bunch of other disorders that can come together.
Okay.
So you can have
So
something
that's also
called
a spectrum.
So right. So you can have something called ODD, which is oppositional defiant disorder, or you can have anxiety disorder, or you can have depression, or you can have other things that may come into play, and all of that can, we just look at them as one ADHD, or that's the term that most people associate with.
So when we put up this question on MyWholeChild, a couple of things that kept coming up was stop and talk, like notice, and which I thought was so, was relevant. It's a very A for apple kind of solution, but it's pretty relevant because there is a, when you think about it, every time there's a child that acts up, you try and use a distraction technique, right? And if you cannot distract the if you can't distract the child, then you go to the next thing that can distract the child, and then it just acts and it elevates, and that's when the child starts believing, I guess, that they can get anything when their parents are busy. But I think in some ways, if that is also a cry for help, like for attention, so to speak,
right? It is an attention-seeking behavior,
and
right?
you have to listen, right?
Right. So understanding what your child really wants and what are the issues with the child.
Yeah.
That's the only way you can move forward.
Right.
Okay.
Right.
So then, when you take that problem to your pediatrician,
right,
then the pediatrician should act and come up with a management plan.
Correct.
First you come up with a diagnosis.
Correct.
And then with the diagnosis you come up with a management plan.
Right.
So the management plan may incorporate medications.
Yeah. I was going to ask you that. So is that normal?
It depends on the degree of ADHD.
I'm assuming that most of it is allopathic in nature.
Sure.
Dr. Naveen Mehrotra of MyWholeChild.
So that is one of them. And then the other thing is, because obviously I'm not trained as a homeopath or an Ayurved,
Yeah.
I may recommend that to the parents and say,
Right.
why don't you try this?
Right,
Okay.
right.
And at the same time, then you may
Do the
do the
meditation
behavior.
or the yoga
Right.
or
So-
things like that. Okay.
So things
okay.
like that, trying to train the child on how to better manage their behavior.
Yeah.
Okay.
But so I think there are two lessons over here, right? That when it comes to temper tantrums, kids can have them. Don't take it personally, right?
All kids will have them. And I think
will have them.
And all adults will have them.
I know. And last time you had said that kids emulate their parents as role model. So therein lies that lesson. But the point is that, that when kids do act up, it was a lesson for me personally. I really had to step back and say, I cannot have a radio program on a topic that I'm not doing. I had to literally hold my daughter's hand and say, "Can you please?" She was in tears over a rubber ducky, and there was a rational part.
But that is what kids are, right?
Yeah.
That is what they don't care
Yeah.
what anything or everything. That is what they want at the time.
No,
is
she
what
wasn't
they
wanting
want.
it. It was
No,
just
but
she was
they-
trying
they
to tell
don't-
me she was upset.
Right. So, but she wanted your attention.
Right.
So that is what she wanted.
Right.
So
Which of course I
guess-
didn't understand when she was
So,
stomping around the house
for
angry.
and listen, and for the people who
Yeah.
are Hindus in the
Yeah,
audience,
yeah.
the whole story about how somebody wanted the moon, right?
Yeah.
Krishna and all that. So that is what.
I don't know that story. What's the story?
When Krishna wanted the moon, his mom said, yeah, right?
Take it in that platters. What did he say?
As a reflection, because
Yeah.
she couldn't get that.
Yeah.
Right? So those are the things. When a kid wants something, the kid wants it now, and the
Yeah.
parent has to oblige
Yeah.
to the point, or make the child more comfortable about it.
Right.
To understand why the child really wants it.
Right.
And you have to
Right.
stop what you're doing.
Right.
And you have to pay attention.
Right, and I really don't think as parents we're doing enough of that. I just think that as a world we've become so,
So
we're
busy,
glued to
so
our
busy.
smartphones,
Right.
we're glued to everything, so.
Right. So I think we need to have a comprehensive approach.
Yes.
Which involves parental training,
Yes,
which may involve medication,
yes,
and which may involve behavior modification,
yes.
and diet,
Yeah.
and nutrition,
Yeah.
and so on.
So it's almost like a holistic
It's a
360-degree
right,
approach.
Right.
It's amazing how quickly time flies, Dr. Mehrotra, when you're here in the studios and we're talking about holistic approaches like MyWholeChild. Join the conversation on the MyWholeChild page on Facebook. You can contact Dr. Naveen Mehrotra at drmehrotra1@gmail.com.
Or they can access us through the website,
Yes.
our office website, or through the MyWholeChild.
Which is very easy to remember. It's myWholeChild.org or
Right.
it is Dr.
Or definitely go
Mehrotra.com.
to Facebook and join that. And,
Yeah,
and
yeah.
we love to hear what other parents have tried.
Yes.
So if it is ADHD, what have you
Yes.
tried? What has worked?
Yes.
And I was actually just speaking to a parent on my way in,
Yeah.
and she wanted, her child is recently diagnosed with ADHD and ODD,
Oh
and
my
she
God.
wanted to know how does she do, what does she do, where does she go from here?
Yeah, outside
So-
of taking it personally,
Right.
finding solutions.
Finding solutions. So I think there are a lot of things that our community may just say, oh, let's go to this Baba or let's go to this prayer
Yeah.
ceremony and get
Yeah.
that done with.
Yeah,
So we really have to figure out what is the best way of doing that.
right. Well, we're going to continue the conversation in 2 weeks. So, like I said, join our page on Facebook, or you could go to our websites, MyWholeChild.org or drmehrotra.com. Thank you. As
Thanks a lot,
always.
and thanks for joining
Yes.
in on this. And we will continue. I know ADHD is a very big topic, and behavior modification and behavior management is a huge concern for a lot of our parents. And especially if there are newer immigrants coming into the country, their way of managing children is very different than the way we manage kids here. And they need to maybe bridge that gap, and we need to help them bridge that gap.
MWC Bridgewater.